just a quick review of the shoulder pulley. Basically, this particular one, and there's a lot of them out there to choose from on Amazon and on the internet, so it's hard to know what to look for. I would look for a couple main things. First, let me start saying that this is probably about as simple as it gets as far as a shoulder pulley. It's no frills, and it gets the job done. But two things you want to look for that might make a difference to you. The first one is actually the handles. So the handles can come in like foam, they can come in plastic, and the other ones I've seen are wooden handles, and this one has a wooden handles. If you're worried about keeping a grip on it, I think there's better ones because there's some that actually have a little glove that will Velcro your hand to the handle. And then some of them, foam handles, I think are a little bit easier to grip and stay gripped on. But if that's not really a concern, your hands are fine, your grip is fine. Wooden ones are fine. The other thing is if you're concerned about cleaning them, I know if somebody's buying this for like their physical therapy clinic, you would want something like plastic or wood so you can clean it in between patients. But if just for home use, if you're not concerned about cleaning anything, foam is fine. But that is one advantage to having the wood handles as well. And they're pretty sturdy too. The other thing you want to look for is the clip. So there's two main things with shoulder pulleys. They either come with a metal clip like this that goes over the door frame. And the other thing is if they don't have that, they have like a strap. There's actually one I reviewed the other day that actually has both. But the strap is just like a cloth, nylon strap that you just put in between the door frame, and then you close the door and it stays. Why would you choose one over the other? If you're concerned about scratching your door at all, you would want to use one that has a strap. You wouldn't really want this one. But if it doesn't matter to you, you're not really worried about damaging your door, the metal is fine. Some of them actually don't come. Now this one has a rubber here, and it also has a foam pad there. So this would be, it would do a better job of not scratching it, but you never know as you get that thing on there, if this is going to become compressed or if it ever falls off, you might be scratching it. But, as metal ones go, this one's not too bad as far as maybe doing damage to your door because it does have these. I've seen some that really don't have any at all, much protection at all. So just something to be aware of. So yeah, if you're looking to actually, this is for just basically not for strengthening your shoulder, but basically it's for range of motion. So if you have, tightness in your shoulder, or you need to make it more flexible, or you have stiffness, this is what you want to use. And basically it works by having one arm help out the other. If you have the two bad arms, you just kind of make the best of it. The other thing, it might strengthen a little bit if you can hardly raise your arm up. Like if you've had a stroke and you can't even lift your arm off the table, then you can use the good arm to raise up the bad arm. So in those cases, extreme weakness, yeah, you might do a little bit of strengthening with this. So basically this is all about range of motion, increasing flexibility. If you are looking for strengthening, I'd recommend, say you have shoulder pain, you're trying to strengthen your shoulder, I would recommend strengthening your rotator cuff. This is one resource you could check out. There's others. 6-minute torn rotator cuff solution for seniors. Although I don't know what that's about. Athletes could use this as well. Basically, if you have any kind of a shoulder problem, you want to make sure that you're strengthening your rotator cuff. And I'll tell you why. The rotator cuff is a very shallow ball and socket joint, and it depends heavily on muscles to stabilize it, okay? Not like the hip. The hip's a ball and socket joint, but it's a deep ball and socket joint. Doesn't really rely much on the muscles. But the shoulder really is all about muscular support. I mean, of course, it does have some ligaments, but because it's so shallow, muscles are really the key thing that stabilizes and keeps it in place. And if you have weakness in your rotator cuff, what you get is you get excessive motion in that ball and socket joint, and everything gets irritated. So really, no matter what your shoulder problem is, if you have like a tendonitis, a bursitis, shoulder arthritis, basically the more stability you get in your shoulder joint, is the less irritation, the less things are going to get irritated in your shoulder joint, and the better you're going to feel. Plus you'll be able to stronger, be able to move your arm around a lot better. But if you have torn your rotator cuff, this is one of the better resources out there, I think. It starts out with just some basic anatomy, like a lot of them do. If you're a real visual learner, you'll like this because there's tons of pictures. It has a good question and answer section. Just about everything you ever wanted to know about the rotator cuff is in here, but it's real easy to read. It's all in layman's terms. What are the symptoms of a tear? Any arm maneuvers that might indicate I have a tear? What imaging tests are used? Where does it tear at? Just a ton of questions. Are there different kinds of tears? Here's a good one. I have a tear in my rotator cuff and I'm in a lot of pain. I need surgery, right? Well, not necessarily, and let me tell you why. This book is very evidence-based and it uses studies to answer these questions, and each one of these boxes is studies in layman's terms so you can understand it. So the answer to that question by looking at studies where they say they take 100 people that have like a rotator cuff tear, and then they measure the size of the tear, and then they check the pain level. They see how much pain the person's in. Like they might ask them a visual analog scale. So here again, you have like say 100 people. You know the size of their tear, and you know how much each one of them are hurting, how much pain they're in. What they're finding in these kind of studies is that there's a fair amount of people walking around that have asymptomatic rotator cuff tears. In other words, they have people walk around, they have a tear in the rotator cuff, they have no pain. And this actually, it comes more frequent as you get older, because as you get older, like especially in your 60s and 70s, incidence of rotator cuff tears really goes up. And a lot of them are asymptomatic. So what you don't want to do is have your rotator cuff repaired and fix it, the tear, when really that wasn't the cause of your pain. Maybe you had an asymptomatic tear and you don't need the surgery because something else is causing your pain. So it's just something to think about. What happens if I just leave my rotator cuff tear alone? Here again, they look at long-term follow-up studies of people that have a rotator cuff tear that for one reason or another never get treatment for it. And then they follow them over time and they see what happens, does it get better, same, worse? Probably the best question in all I like. So how does exercise compare to surgery when it comes to treating my torn rotator cuff? Okay, so the only way to answer that scientifically, to know for sure, is to look at the randomized controlled trials. The randomized controlled trial is the highest form of proof in medicine that a treatment's actually effective. So this book has compiled all the randomized controlled trials that went through the literature comparing exercise to surgery. So that's where you'd maybe take 100 people that have a torn rotator cuff, 50 randomly assigned to surgery, the other 50 randomly assigned to an exercise program. Then you follow them over time. 6 months, some of them are years of follow-up. So let's say a year from now, who did better? The people that had their rotator cuff repaired surgically or those that did an exercise program? So to make a long story short, you're going to end up pretty much in the same place. Anyways, they have bookends with a nice exercise program. There's 3 different levels, so there's something for everybody. If you can hardly move your arm, or if you're like, you're in the gym, but you just need a little bit of tune-up. So if you're looking for strengthening, and it has a lot of stretches in here too for the rotator cuff and shoulder, this would be a good resource. But hey, if you just have some stiffness in your shoulder, you need a little more flexibility in it, I think this is a nice, simple, no-frills kind of shoulder pulley. So check it out.